Hey everyone, Jeremy Thompson here. Welcome to our January edition of the OrthoCarolina Live webinar series. Again, I'm Jeremy Thompson. I'll be taking through lumbar stenosis. Again, just a reminder, this webinar will be live streamed on our platforms, including Facebook, LinkedIn, and YouTube. So a little bit about me. Jeremy Thompson, one of the spine surgeons here in Charlotte. I'm a Charlotte native. Graduate of Charlotte Christian School. After high school, I went to Wake Forest University on a football scholarship. After a short career in the NFL, I came back to med school at UNC Chapel Hill, and then off to orthopedic surgery residency at Mayo Clinic, and then on to spine surgery fellowship at the Leatherman Spine Center in Louisville, Kentucky. And without further ado, we'll talk about lumbar stenosis. But before we get too far into it, I think we need to brush up on some anatomy of the spine. So the bones of the spine are called vertebrae, and this here is a lumbar vertebrae in particular. And there's a number of parts of the vertebrae that we should understand in order to understand lumbar stenosis. So first, this here is the vertebral body. It's this block piece of the bone here, and that is the weight-bearing portion of the bone. Then on the back side of the bone here is the lamina. And if you look at it like it's a house, this is the roof of the house, and this here is the spinal canal. You also have a pair of little joints in the back of the spine called facet joints. These allow some motion of the spine and also contribute to some stability. And the connection between the two, or the pedicles, is the corridor that connects the front of the spine, the vertebral body, to the back of the spine. And then these little projections here are where muscles attach. This is the spinous process. It's the bony piece that you can feel when you touch on the back of your spine. And then these are transverse processes. So those are the bones of the spine. There's also soft tissues. So in between the bones of the spine, in between the vertebrae, these vertebral bodies, there's an intervertebral disc, and that's a gel-filled disc that acts as a shock absorber of the spine. There's also a spongy ligament in between the lamina that allows some stability and flexibility of the spine, as well as some protection on the nerves. So the spinal canal is actually made up from the little holes at on each vertebrae, and these holes are stacked up on top of each other. There's the vertebral foramen, or the central canal. It's like the main highway where the nerves travel from the brain through the spine. And then at each level between the spine bones, the vertebrae, nerves exit through the neuroforamen. I call that the exit ramp, when the nerves leave the spine. So what is lumbar stenosis? So lumbar is another term for the low back, and stenosis is another term for narrowing. So lumbar stenosis is narrowing of the spinal canal. And that spinal canal, again, is the passageway where nerves travel from your brain through the spine and to the legs. So what causes lumbar stenosis? Well, usually it's due to arthritis, wear and tear changes of the spine. And that arthritis can be disc degeneration, where you get bulging and flattening of this disc here, which can encroach into the spinal canal. You can form bone spurs on those facets that we talked about earlier, and those facets encroach into the spinal canal. You can have instability, or a quote unquote slipped disc that can pinch the nerves in the back. But really, it's a combination of all those things together that can put pressure on the nerves in the spinal canal. There's other things like injuries, disc herniations, fractures that can cause it. And some people are just born with spinal canals that are smaller than average, and that kind of predisposes them to having additional tightness when they have wear and tear changes. So again, who gets lumbar stenosis? Well, more of what I alluded to before. As we age, we get wear and tear changes. So in this large study, we found that about 20% of people under the age of 40 have lumbar stenosis. And as you age, that increases to about 50 or even 60% of people. Other risk factors are things that lead to more wear and tear changes in the spine, like obesity, smoking, the congenital stenosis, being born or developing a spinal canal that's more narrow than average. And commonly, jobs or activities that yield repetitive spine stresses, like bending and twisting and lifting, can yield more and more wear and tear changes that sometimes encroach on the nerves in the spine. So the symptoms from lumbar stenosis can be vast and wide. It can be anything from no symptoms at all to back pain or leg pain that radiates from the buttocks, the thighs, the calves, the feet. You can get numbness and tingling or even weakness down the legs. But really, anywhere those nerves travel, you can have symptoms. And those nerves travel from your low back all the way down to your toes. But generally, from lumbar stenosis, those symptoms are worse when you're upright and better when you're leaning forward or sitting down. So just because you have lumbar stenosis, it doesn't mean that you have symptoms of lumbar stenosis. As I said before, you can have lumbar stenosis but not have any symptoms at all. In fact, in a study here that we as spine surgeons reference a fair amount, we found that a third of patients with no symptoms at all have lumbar stenosis or disc herniations. And again, as you get older, that prevalence or the number of people that have stenosis is higher and higher and higher. So if you have lumbar stenosis or you have symptoms of lumbar stenosis, well, what do? You go see your doctor. And at the doctor's office, we'll take a history. We'll find out where you hurt, how long you've been hurting, what you've tried for it. We'll do an exam where we test the strength of the legs and how well you can walk. We'll take some x-rays, perhaps get an MRI or CT scan. But importantly, we'll try to correlate those image findings to your symptoms and also rule out other things that may cause pain in your legs, like hip or knee arthritis, sacroiliac joint pain, or vascular disease. So you have symptoms from lumbar stenosis. You've got back pain or pain that goes down the legs. But what do you do about it? Well, the mainstay of treatment is actually non-operative. You start with physical therapy, where they work on some core strengthening exercises, some flexibility. They work on your walking. They do some treatments like massage or modalities like ultrasound and TENS units. You can try medications for pain or for inflammation. You can try muscle relaxers or nerve pain medicines or even steroids sometimes. You can try things like a chiropractor, acupuncture, or massage. You change your activities. Essentially, you avoid the things that irritate your back and your legs, and you do the things that make it feel better. And at the end of the road, you can try injections where we inject steroid directly around the nerves to calm down some of the inflammation that may be causing your pain. So non-operative treatment can be effective. Just because you have lumbar stenosis and you have symptoms from it, it doesn't mean that you need surgery. In a study, the researchers looked at patients with lumbar stenosis and they followed them over 10 years. And they found that a third of people get better with non-operative treatment. A third of people have stable symptoms. They don't get any better or worse. And about a third of people do have worsening other symptoms, and they tend to go on to need surgery. So if you need surgery, surgery actually helps people. It works. In a large randomized controlled trial, it's the best study that we can do, where essentially all things are equal. They compared people that treated their lumbar stenosis without surgery and people that treated their lumbar stenosis with surgery. And they actually found that people that undergo surgery, an unpinching of those nerves that are pinched, had greater improvement of pain and function up to 4 years after surgery with the surgical treatment. Now, what does surgery entail? Well, there's many, many options, and it really depends on the type of stenosis and the type of symptoms that you have. There's an unpinching or a decompression only type of procedure where we unpinch the nerves, but we don't do a fusion. And then there's the unpinching with the fusion, and it really depends on what kind of condition your spine's in and where the tightness is. The unpinching or the decompression procedures can be anything as small as making a small opening in the bone and removing that disc that's putting pressure on the nerves, or doing a laminectomy where you remove the entire lamina to make more pressure or make more space for the nerves, or other things like laminoplasty or interspinous device. That's more of a topic for another conversation. And then if there's some instability or tightness in specific places in the spine, we may need to do a fusion. And there's a whole host of techniques and methods to do a fusion in your spine. But all in all, surgical treatment for lumbar stenosis is effective and it does help people. So with that, I'll turn it over to some questions and comments. And just a reminder, this is being recorded and will be posted on YouTube. right, so for some questions, is it common for those with lumbar stenosis to later in life experience stenosis in other sections of spring and or their neck? Yes. So there is a condition called tandem stenosis. And typically when people get arthritis in their backs, they get arthritis everywhere else in their body, their hips, their knees, and their neck, and their mid-backs. So when you go see your doctor with low back complaints, at least it's in my practice, I always check the neck as well. I'll check the strength of the arms. I'll check reflexes. If there's any abnormality or any suggestion that there's tightness in the neck as well, I'll end up evaluating that as well. All right. Can spinal stenosis be corrected by physical therapy or with daily exercise? So yes and no. So once you have spinal stenosis, the only way to quote unquote cure it, to make more space for the nerves, is with surgery. But just because you have the stenosis, it doesn't mean you have to have the symptoms of stenosis. And therapy is very effective at trying to optimize your spine, your lifestyle, your health, in order to make it more likely that you don't have the symptoms of spinal stenosis. So how long does it take to recover from surgery? Well, it really depends on what surgery is. So a smaller surgery obviously has a quicker recovery, but a bigger surgery has a longer recovery. And typically, if you have an unpitching only surgery, that surgery is a lot quicker because you don't have to heal a fusion. You don't have to wait for the bones to heal together. But when there is a fusion, typically it's a longer operation. It's a more morbid operation. There's a higher blood loss, more muscle dissection. Typically, you have to stay in the hospital. Maybe that's a day, 2, 3, 4 days in the hospital sometimes. And we typically give you restrictions. We don't want to stress the hardware so much that it decreases the chance that the bones heal together. So in short, a smaller surgery has a quicker recovery. A longer surgery has a longer recovery. All right, so will the Vertiflex spacer surgery help with pain? So the Vertiflex spacer is one of those interspinous process spacers. And I have a model here. So if you look from the back of the spine, again, here's the vertebral body. Here's the lamina and the spinous process. Here's lamina and spinous process. If you see here, in this alignment, which is a normal alignment of the low back, there's some pinching of the nerves naturally. And the Vertiflex procedure is when you put in a spacer in between these spinous processes and you open up that space. And if you can see here, it makes more space for the nerves. Well, it's a small procedure. Many times you can do it in an outpatient surgery center or under local anesthesia. It makes more space for the nerves. But as orthopedic surgeons, we care a lot about the alignment of the spine. And if you bend the spine forward, it may cause more problems long-term down the road. So it is an option. It can help with pain, but in my practice, there's a select indication of when it's better or the risks or the benefit of the surgery outweighs the risks. So what is the most common treatment? Well, for lumbar stenosis, by far the most common treatment is physical therapy and conservative care, time, injections, things like that. Again, most of the time you can get by with conservative therapy. And only a select few patients have symptoms that are prolonged long enough or severe enough where they want to go forward with the surgery. All right. If I had spinal stenosis surgery in the early 90s, would treatment be different now? Well, yes and no. So the treatment for spinal stenosis is making more space for the nerves. And obviously over time, we've developed different techniques for it. You can make smaller incisions. You can do surgeries with different types of tube retractors and less muscle dissection. We have different anesthesia protocols. We have different rehab protocols. So all in all, it's still the same kind of surgery where we make more space for the nerves, but the recovery is a little bit different. The techniques are a little bit different. I like to say that we're doing things a little bit cleaner and better than we were doing 30 years ago, but essentially the surgery is making more space for the nerves. For the lumbar decompression. Oh, all right. Well, that looks like it's it. Thank you again. And just a reminder, this will be recorded and posted on YouTube. And that's it for our January live webinar.